Okay, just give me a minute. Yes, okay. Good morning, everyone. Glad to be here and thank you for joining us. I'm Zara Sarani and I feel honored to introduce an amazing visionary and an advocate for the racial and social injustice and a phenomenal Rotarian, Mr. Aziz Memon. I met Mr. Memon back in 2020 BC, that is before COVID, in February in Karachi, Pakistan, and was amazed by his passion for the Rotary. He's the current trustee of the Rotary Foundation, member Rotary International Polio Plus Committee, chair for the Rotary International Polio Plus National Committee for Pakistan, member the Rotary Foundation Awards Review Committee, and the list goes on and on. He became Rotarian 25 plus years ago. And when he was asked why, his reply was, because working for humanity is universal. It holds no boundaries, no cultures, and no religion. It brings me closer to people who are also involved in the same field and gives me great pleasure to work with them. Mr. Memon leads Rotary polio eradication efforts in Pakistan for the past several years, has worked closely with partners and stakeholders, including WHO, UNICEF, government officials, religious scholars, celebrities, and corporate executives from multinational companies and Rotarian from all around the world. He has received several awards and accolades, such as President of Pakistan Pride of Performance Award, Louis Pasteur Medal by Pasteur Institute France, Service Above Self Award, International Service Award for Polio Free World, Regional Service Award for Polio Free World, Distinguished Service Award, Rotarian Foundation, Citation, and many more. Professionally, he's a chairman of the King's Group, the leading textile manufacturing and exporting group in Pakistan. He's the Honorary Consul General of Republic of Suriname. He is married to Professor Samina Aziz, and both Mr. Memon and Samina Aziz are members of Arshklum Society Chairman Circle. So without any further delay, let's give a warm Zoom welcome to Mr. Aziz Memon.
Thank you. Before I come to the presentation, I would like to speak to you for a while, and then we can show the slides. Is it all right with you, Dana? Yeah, I'll speak for a while. Yeah. Thank you, Zara, for the nice introduction. And I was looking at my picture. That was in March or February.
Correct.
And so last 4 months, I've taken off 4 kilos. So I was just wondering that I should have sent my new picture, but that was perfectly fine. I look good in that also. Okay, so let's start. That Rotary does magic. Whether it is putting up a clean drinking water system, whether it is providing a book, whether it is planting a tree, whether it is providing an artificial limb, or giving polio drops. We are into serving humanity. Wherever the need is, we are there. Just look around that in last 6 months when COVID-19 struck, Rotary Foundation went into action. We approved almost 325 district grants of $25,000 each. We approved 369 global grants for COVID. The Rotarians were on the forefront, doing so many acts. In my country alone, we got 4 global grants. We provided 10 ventilators and so much stuff for fighting COVID. And not only that, but the infrastructure and the logistics made for polio went into action to stop COVID from further spreading. And I'm glad to share with you that we were able to flatten the curve. The schools have resumed. Not only that, we were able to resume the polio NIDs. Now, coming to polio, we have a good news first that Nigeria is no longer on the endemic country. So we have two countries left, Pakistan and Afghanistan. In Pakistan, we had last year a setback that was in 2019 due to a fake campaign in which no child was killed by OPV, but there was a fake news and 300,000 children in Peshawar ended up in hospitals in 2 hours. Our campaign was disturbed for 6 months. We put it back on track. And this year, as we were moving forward, our campaigns got suspended for almost 6 months. So I'm glad that we resumed the campaigns on a small scale in the month of July, keeping COVID on a side, then took it on a larger scale in August by responding to the polio derived cases and also doing taking care of the mop up on the registered cases. In September this month, finally, after a break of 5.5 months, we were able to resume our full-fledged NID, that is National Immunization Drive, which targets 40 million children from the mountains down to the ocean. And whatever reports I got so far is that the campaign round was good. Yesterday, I was in a Bourbon, a hill resort, where we had a operational review meeting. This was organized by CDC, and I was able to sit with the frontline people and discuss as to what challenges they face and how they will move forward. So we have a roadmap now that in the month of October, November, December, we will go ahead and have the full-fledged NIDs all 3 months. In November and December, we would be using the trivalent vaccine, which is being specially made for Pakistan and Afghanistan. And that trivalent will be able to target both the viruses, whether it is derived virus or it is wild virus. So we hope that with the support of the government, with the support of the Pakistan Army, because when I said that we did a good round in South Waziristan, it was because of the help of the Army, with the support of the Rotarians, with the support of our partners, WHO, UNICEF, Bill and Gates Foundation, CDC, and everyone. So we want to do our best. The Chief of the Army Staff also has said that in 2021, we will be able to stop transmission. And it has been 42 years since we started this struggle of polio eradication with 75 endemic countries. Now we are just with $2.6 billion have been put into it. And we feel that by the time it is completely done, it would cost Rotary $3 billion. This would be the largest singular health campaign ever carried out in the history of mankind. The last goal we achieved was in 1968, when smallpox was eradicated once and for all. And we have a challenge again in front of us to make history. I want to support and thank all the Rotarians who are contributing to the Rotary Foundation. Please continue doing that. Do not stop, because as we run the last leg, we will need each and every dollar. Now, there were a few things, when I spoke of wild polio virus, I spoke of derived cases. So I have a few slides to show to you that how do we explain that, because for an ordinary Rotarian, these questions are a little bit technical. So let's have the first slide, my friend. Yeah. Now this is why does CDVD2 is outbreak. This is what we call derived cases. Now someone has said this is our vaccine derived, but that is not the right thing to say, because these cases occur because of the low immunity to type 2, and it comes up when the routine immunization goes down. Philippines had the highest routine immunization, but 2 years back they had a fake campaign not fake campaign, it was a, sorry, not fake, 4 children died of measles. Expired vaccine were used, and I met the health minister last year, and he admitted that because of that, the parents lost trust in vaccines. The routine immunization in Philippines came down from 92 to 22%. And what was the result? They got 8 derived cases. So derived cases these are the reasons for derived cases: regional migration patterns, low quality outbreak response, use of monovalent OPV2. Now, just now I mentioned to you that in the December NIDs, we are going to use the trivalent. Trivalent was discarded. Now we have got it made again, so that the trivalent will do a dual job of tracking the wild polio, at the same time derived. The next slide, please. This is the response strategy of the derived cases. We call it CVDP2. So this just gives you a little glance as to what we are talking and where we are coming from and what goals we have to achieve. Next slide. Now, I did mention that we will be using trivalent, but there was a research going on for some time that what could stop the derived cases. Now, see, Nigeria has been declared wild polio free. They are having derived cases. The derived cases are in Cameroon also, everywhere. So a new vaccine has been approved. This is the novel OPV2. Now, this vaccine is not yet available. We were told it would be available in September, but it would definitely be available by the end of the year. And this vaccine, novel OPV2, will do only one thing, that it will take care of the derived cases. And that would be a big blessing now, because today, the wild polio cases between Pakistan and Afghanistan are just more than 100, around 110. But the derived cases are, with the last count, it was around 443. So we need to target the derived cases, and novel OPV2 will do that job. And we are very hopeful that novel OPV2 will do wonders. Next slide. Now, initial use of novel OPV2, where it will be used in Africa, Asia Pacific, Middle East, and the countries which are at high risk of derived cases outbreak. Now, 27 countries in Africa region, plus Djibouti, Iran, Libya, Sudan, Brunei, China, Malaysia, Papua New Guinea, India, Indonesia, and of course, Philippines was there already on the upper list. So these are the countries where we are going to use the novel vaccine, which would be targeting the derived. Now, there was a couple of cases in Malaysia, one case in Myanmar, Now, these are all derived cases, and we should be able to stop that transmission with the derived cases. And as far as the wild polio cases are concerned, OPV is the answer. And we do 2 rounds of IPV also. We do 2 rounds of IPV, which builds up the immunity in the baby, but till the environment and sewage samples are positive, we need to continue OPV. That is the answer. Next slide. Now, COVID-19, as I told you, put everything on the side. Today also, when I was in this review meeting in Bourbon in the Hill Resort, maybe Zara would tell you where it is. So what we were told that the frontline workers who have been provided with face masks are not following the SOPs properly, and they need to be more rigid in following the SOPs. We want them. We want the front line. For one campaign to target 40 million children, we are using 120,000 frontline workers, training them. Now, they have to do the noble work of saving the children from the crippling disease, and at the same time, they had to take care of themselves. So when the rounds were put aside, 80 million children were at risk of polio, measles, diphtheria, meningitis, tuberculosis, all the diseases you know. So polio resource centers supported the response of COVID. And now this is the old one. It says that we are planning to resume. We have resumed. And I gave you that from July, August, September, where we have reached. Next one. Now, potential impact of SIAS on COVID transmission. This is showing a graph that how the polio immunization were affected and the risk to polio workers. Now with the putting aside the COVID-19, and hopefully we will be further expanding our activities cautiously. Safety of the frontline worker is very, very important. So whatever we do not want to endanger the lives of our frontline workers. Next one. Now, this is just showing that conducting polio immunization will not substantially increase. Now, this also was a question which came up before. Now, that has been answered, that when we were told that if you want to start the polio rounds in July, make sure that you do not aggravate the situation of COVID. We were very, very careful. We did not aggravate COVID. And COVID gave us room, COVID gave us space, so we have expanded our reach. And now, as I told you, that September round was the first round in 5.5 months where we targeted the whole country, 40 million children under the age of 5 years. Next, please.
I believe I am fresh out of slides for you. Yeah.
Yeah, thank you. Thank you. So we can, I will talk a little bit more about the foundation, but if you have any questions, Justin or Zara on polio, or any queries on what I said, I would be too pleased to answer. Then I'll talk a little bit more of Rotary Foundation, and I'll show you a small video on Rotary Foundation. Over to all of you.
We do have time for a few questions. If anyone would like to jump in with a question, we'll give it just another 30 seconds or so before we move on with the video. We did have a question in the chat about whether these slides would be available. And yes, we have these slides that were just covered. And I'm going to speak on behalf of Nancy Paulson that we can put them on the district website along with the recording of this entire training this morning. So all this information will be available to all of you.
And this is Nancy Paulson, and I'm anticipating getting all this stuff posted by Wednesday or Thursday of next week.
Thanks, Nancy.
Nancy.
Okay, Justin, maybe we can move
Okay, so I was telling you about, I started with the Rotary Foundation, and before I show you a small video, I want to tell you one thing, that Rotary Foundation is a two-way stream. You give and you take. You showed that you are doing so many global grants for Honduras, water projects, so many nice things you're doing. But at the same time, you need to continue giving to the Rotary Foundation. We had a goal of $409 million for last year. In spite of COVID, we achieved it. And this year, the trustees have set a goal of $410 million. Plus, we have a Polio Plus challenge fund of $50 million, which is matched by Bill Melinda Gates Foundation 1:2. So when we hit $50 million, $100 million pours in to support the polio program. So please keep on doing the good work. And if you find it a good opportunity, do support some districts. In Pakistan also, they do many global grants. We have many USA districts supporting us in clean water, in artificial limbs. And we have a current global grant which is which has got the number, which will be filed soon. This is for providing the dialysis machine, 26 dialysis machine to a hospital which is in a very low slump area. This is a global grant of $440,000. Our club, Rotary Club of Karachi, has already raised $200,000. But according to the new rules of the foundation, this will not be matched into half. So we would be relying on DDF. We have got some commitment, and I'll share that grant request with Dana and Sarah also, if you can circulate and have a look at it. And with these words, I will say goodbye to you. But before I say goodbye, you will be listening to the foundation clip. And one more request is that please remember that World Polio Day is going to be on 24th October. Do plan some activity, small or big, to remember Professor Jonas Salk, who gave us the vaccine. Today, for COVID-19, we are concerned and worried when the vaccine will come. Here you have the vaccine for polio. Let's make the best use of it and make the world polio free. Thank you. Rotary Foundation.
Rotary has never backed away from the hardest challenges because
Can we hear and see that okay?
More equitable world. This year is no exception. Staying away from people and places we love in order to keep them safe. And despite the challenges, your generosity continued. Your donations provided more than $7 million to fund coronavirus relief projects in communities worldwide. And thanks to you, citizens of Kigali, Rwanda have their first public library. Women in rural Costa Rica are enriching their communities through social entrepreneurship. At-risk kids in Puerto Rico have an artistic outlet to heal their emotional traumas. Rotary and its partners have reduced 99.9% of polio cases worldwide. Thanks to you, the Rotary Foundation raised $408 million last year. So together, we can keep doing good in the world. Donors who take action help create lasting change. Our work isn't possible without you.